Hey Pilates teachers, it's Lynda Lippin here, and I am here to talk to you today real briefly about what to do when your Pilates clients come in with lower back spasms. It happens relatively often. We kind of wish it didn't, but it does. So what exactly do we do when this occurs? This was actually asked in a private Pilates group earlier today, so I thought I would address this in my video today. The answer is really to not go near that lower back. The answer is really to do what we kind of teach in classical Pilates, which is that you're going to work around that back. And I'll tell you why and what I mean by that. Okay, number one. Most people who are having a lower back spasm, it's because their lower back has actually been moving a little too much. So they've either been sitting too much and slouching, they've been moving stuff, they've been picking up heavy boxes, whatever it is, whatever it was that they're doing started getting their lower back moving way too much, and then they strained themselves while their lower back was moving. And that's what causes the lower back to start to spasm up, because the muscles in your lower back are not primary movers. The muscles in your lower back are supposed to kind of hold steady and stabilize your back between your rib cage and your pelvis. So if they're moving way too much when people are outside of the studio, I can guarantee you that they're going to be in some kind of spasm when they get back to you in the studio. So what you're going to do with those folks is actually keep them as stable and neutral as possible. Now, what does that mean? That means that you're going to help them find a neutral pelvis. Note, I'm not talking about neutral spine. Neutral spine is not a thing. Spine curves look different on everybody. My 70-year-old client with severe scoliosis, her neutral looks very different from mine, and from most of my clients. So neutral spine I don't go near. Neutral pelvis we can define when the hip bones and the pubic bones are in the same horizontal plane. If you're teaching Pilates and you've got somebody lying down on the reformer, that means their sacrum and the rib cage are going to be heavier on the reformer than their lower back. It means their lower back may not even be all the way down on the mat, and that's fine. So when these folks come in, for me, what I start to do is I work them in that neutral pelvis. I help them find it. I help them breathe there. And then we do some of the basic work where you're not moving your back, right? We do some footwork. We can do some 100, even if they need to keep their head down. We can do some leg circles and frog, not short spine. We can do some coordination, possibly keeping the head down. By then, things might be a little bit better. But what you don't want to do is go right into stretching that lower back. Stretching, thanks guys, stretching that lower back is not going to help. Okay, we're not there to help them stretch and lengthen the lower back. I can tell you right now that if a lower back is in spasm, it's not going to release and stretch when they're in the Pilates studio. And frankly, people don't need so much lower back stretching anyway, which is why they're getting the spasms in the first place. Always remember the pelvis and the lower back should be stable and not move so much. It's the most of the movement we have in our backs is in the rib cage and in the neck, in that upper back, not the lower. So as Pilates teachers, we kind of need to get out of this place of always thinking that if somebody's tight somewhere, we automatically must stretch it or lengthen it. So if you get your clients really moving, get them stable. Don't worry about stretching the back. Just worry about them breathing, staying stable, and moving without pain. What you're going to find is those clients' backs by the end of the session are going to feel better. And they're going to feel better precisely because you got the muscles around that area to start to activate, right? So if you've got somebody in a neutral pelvis and you've got them doing footwork on the reformer and suddenly they're getting good differentiated movement at the hip and they're getting some great leg work, they're getting some great ab work. Maybe they're doing a little bit of flexion and extension with the upper back only and with the neck. And so again, that pelvis is staying stable. Those abdominals are kicking in a little bit. Maybe that quadratus in the back starts to let go a little. And if you keep all of that going, if you keep that stability of the pelvis, keep the breath going, then ultimately those lower back muscles are going to just find a resting length and they're going to stay there. It's important that all of the other muscles get working. So I encourage my folks who are in lower back spasm to not only do footwork, not only do leg circles and frog, but to even look at things like chest expansion, to look at things like pull straps and T, but without a whole lot of spine hyperextension. If they're in the gym, I ask them to do things like squats. Front squats are great things, again, with differentiated movement at the hip and enough abdominal activation that the pelvis isn't moving all over the place. People in back spasm do not need back stretching. They do not need back lengthening. That's not what they need from us as Pilates and fitness professionals, right? What they need is a focused, structured approach to at least stabilizing the pelvis, the lower back, and the torso so that they can walk out of the studio and perhaps even be able to sit and stand comfortably for the rest of their days, okay? Other considerations here, again, I'm talking about your classic kind of fit client who comes in and is having a lower back spasm that day. If the lower back spasms continue, those folks need to go see somebody. They could have a disc herniation. They could just have a torque in their pelvis that just needs to be released. There's all sorts of stuff they might need, but it's not our job as the Pilates and fitness professionals to diagnose them or attempt to treat them. That's not what we do. I mean, you guys who know me know that I work with people in pain and dysfunction all the time. But I don't pretend to diagnose their pain, and I work with them on what I know to be true about movement and fitness, which is that if they get a stable pelvis, if they start to get the rib cage moving a little more, if they really start to strengthen their deep abdominal muscles, their obliques, they really start to strengthen their leg muscles, the full leg, inner, outer, front, and back, so everything's working. They get strong glutes and strong abductors, and the back muscles start to strengthen as well as everything else, that those folks are going to be able to go out and function in the world better. And in fact, they do, so it works. And in fact, in my back, that works as well. So from me, earlier this week, I took a few Pilates classes. I had clients who were away. I never have time, and I was actually able to take class. Now, if you don't know me, I'll let you know that I've got some sacroiliac instability, probably a disc herniation or two, but I don't worry about it. And I've had shingles on my right sciatic nerve several times, so I have chronic neuralgia down that leg. So I'm in class. We get to short spine. I do short spine. It feels okay at that moment. So I said to myself, awesome, this feels great. I love that exercise. But within 15 hours of doing the short spines, my lower back and my right hip started to really, really hurt. I could feel it right in my sacroiliac joint. I started having nerve pain. I had to take Neurontin. It wasn't pretty. And what I realized is that generally for my body, for my back right now, I teach short spine all the time to my clients. I can't do it. I just can't. Getting into that position with that deep abdominal work totally overstretches and destabilizes my sacroiliac joint in a way that right now in my 50s takes me at least 2 or 3 days of rest and gabapentin or Neurontin to feel better from, and that's not something that I'm willing to deal with anymore. So sometimes people will say to me, well, can't you strengthen yourself and be able to do it? You want to know something? There's minimally 500 exercises plus modifications and variations within the Pilates system. There are tons of exercises that help strengthen me in a way that don't hurt me and that help me feel better. Most of those exercises at this point in my life are exercises that involve stabilizing my pelvis and not moving my spine so much, except in flat, in a little bit of hyperextension, and in upper back flexion, but not so much in the lower back. At this point in time, short spine, rolling like a ball, all of those at the end of the day put me into pain pretty much within 12 to 15 hours of doing them. Now, if that's my body, okay, and I'm fit, I lift weights, I do kettlebells, I do Pilates, I run around, but with my injury history, if those exercises are doing that to my body on a day when I start out feeling okay, what do we think those exercises are going to do to a client who is already coming in spasm? I can tell you what they're going to do. They're going to make that client spasm even more. So again, people come in, they're having that lower back spasm. Keep them, Romana used to say, bad back, keep flat. And she didn't mean compressed, shove the lower back down, posterior pelvic tilt flat. She meant heavy sacrum, neutral, long spine, can we breathe, maybe a little, and that's extension, right? Not hyperextension, but extension. It means to keep people in extended, to keep them long, and then really strengthening arms, legs, and the other parts, so that those back muscles and the abdominals, so that those back muscles can start to let go on their own and function well in a group with everybody else that has to work within your body and within that group. Okay? So, short answer, those clients come in with back spasms. Are you stretching their lower backs? You are not. No, no, no. You're going to work on stabilizing them, strengthening them, save the stretching for another day, okay? And for some of them, if you've got a client like me, you can probably just save that lower back stretching, period, end of discussion, and give us other things to do that'll help keep us stable, mobile, and strong. So thank you guys for joining me. If you're joining me on the replay, that's awesome too. Once again, my name is Lynda Lippin. I'm a Master Pilates teacher at Real Pilates in Tribeca in Manhattan. I also have my own online Pilates business, and basically I view my job in this world to help people feel and function better using the tools of Pilates, fitness, and proper nutrition. And I help mentor Pilates teachers to empower them to do the exact same thing for both themselves and their clients. I just want to spread that love and spread that ability to just help people feel and function better. That's really what we all need to be able to do. So have a great day, and I will see you guys soon. Any questions about doing Pilates or any other exercise for people in back pain or back spasms, leave the questions in the comments right here. I do have a few products that can help you both on the client side and on the teacher side for handling Pilates, including my comprehensive Pilates for back pain e-course. So in a little while, I'll leave some links to those products in the comments for this video. So thanks for joining me, guys. I'm seeing a lot of old friends here on the viewer list. Hi, Lewis. Hi, Sarah. And hey, Victoria, new friend. And I will talk to you guys soon. Thanks so much. Bye.